believes primary health care is critical to keeping people safe and healthy in times of crisis and calm. In this sense,
Dr. Orajitt, and good afternoon, everyone here, and also to the online attendee as well. And thank for very warmly welcome and also introduce. This is like my first ever event that I joined with you all, especially for the Asia Pacific Patient Congress. Actually, my background is from HIV/AIDS, tuberculosis, sexual health, and also the COVID response. But I have another role as advisor to the Ally Improving Primary Healthcare. Maybe you know Primary Healthcare Performance Initiative. So that's why this is like a voluntary position, to ensure that universal health coverage, in particular primary healthcare, are heard, advanced at global, regional, and country level. So I just this is, and again, thank you for the international alliance of patient organization, for inviting me as well. And also thank you to Dr. Neda, but I'm not quite sure Dr. Neda is joining or not, for sharing. It's just like to share what's, happening at the global and regional, in terms of UAC and also primary healthcare. So hopefully you can learn and also join hand with us, because this is, again, like, this is just like a sharing session. So it's not about, providing you around with delivery or something, but it's about our effort, advocacy effort, to move primary healthcare, at global perspective. So you can see, because I'm taking role as advisor to the Ally Improving Primary Healthcare. So this just want to let you know that this, Ally Improving Primary Healthcare, this is like a collective of members of organizations, around the globe. And right now, this particular platform has 100 plus 25 organizations, are a member. And then you can see the next one, we have a group of, advisor. We have, we come from different perspectives, different experts. So you can see next one. Sorry. So I think this is here, maybe most of you already know someone here. So you can see we have, as I mentioned, different background or expert. You can see Dr. Lola there from Chestra Global, Dr. Hip Tihal from NCD Alliance from Mediterranean, Dr. Aminu, he is background from health financing and budgeting, and also Arash is about health economists. Dr. Neda, you can see Dr. Neda, her background is around, or she has, experience around patient. Dr. Professor Sabir, really expert, he is an expert on primary healthcare. And then another one is Patricia, from Kenya. And myself, I'm really focused on community system strengthening, especially for community engagement, community empowerment, and leadership. So I just, to share you something about our role. The role of group of, advisor, just to join the technical meeting to ensure that, the primary healthcare, are strategized, are advised at the global and regional level. And second thing is, our role is to participate in quarterly meeting of the Ally Improving Primary Healthcare Workshop. So we have a meeting, regular meeting with NGO partner or members. So that's why the technical advisor or advisor team can provide or can, contribute, to ensure that the primary healthcare is in the focus, or how to move, faster. And then providing like written, verbal feedback on a specific document, maybe I will share later or in my following slide. And then especially to ensure that each country or each, organization members at country level to champion, UAC, in particular primary healthcare, is, a priority area, in terms of advocacy, in terms of capacity building, in terms of service-based delivery or community-led action. So this is like what we are, how to say, working to move forward. And then this particular opportunity, I mean, advisor, we also, it's a sport, it's a place that we can share each other, you know, around health. I mean, health-related issue, including primary healthcare. So I think one achievement that, how to say, one thing that has been achieved so far and also very important, this is still ongoing, that we really need you to support, to join in as well, like Women Health this morning. We just developed, how to say, one letter that's called open letter. This letter, you know, really focus on, you know, call to action, you know, in order to strengthen health system through a primary healthcare approach. So you will see, then maybe I will share with Dr. Orajitt the link that you can see the whole, you know, key action, whole advocacy-based, you know, action need to be made, or how to say that we advocate, that we, how to say, mobilize the support and also send to the government or head of state, because we understand that in 2023, there will be two opportunities, I mean, two events coming up. One is around United Nations high-level meeting on universal health coverage. It's going to be an opportunity that we can advance, and that we can advocate to ensure that those, or how to say, the global leaders, the head of state, you know, still put, or how to say, they can revisit what they promised, meaning like keep the promise. So they can visit what that has been promised, you know, in the United Nations high-level meeting in 2019. So that's why look at the commitment, look at the target. So that this is around primary healthcare. And another opportunity, maybe you already know, is around 3PR. I mean 3P, 1R, pandemics, prevention, preparedness, and response. So that's why these two opportunities that, as being civil society, how to say, a community, we need to advocate to ensure that primary healthcare is a foundation, is still, how to say, a forefront of the response. So this letter was, you know, organized and also shaped by Allied Brewing Primary Healthcare, a group of, as I mentioned, over 100 organizations from 35 countries who are committed to advocate for stronger primary healthcare, as well as the advisor that provided some specific aspects, some specific feedback to ensure that the letter are, you know, met the how to say, the primary healthcare by the state. So for example, like Declaration of Astana in 2018, Alma-Ata 1978, you know, and then followed by the UN SDGs, Sustainable Development Goals in 2015, and then the recent, you know, a political declaration on UAC, I think just 4 years back in 2019. So, you know, already adapted, but up to now, what's going on? The commitment, as I mentioned, has been made. The promise, you know, to ensure to move the primary healthcare or universal health coverage is, how to say, a key priority agenda of health issue or public health issue. But looking at each country, it's still a problem. So yet the reality of this commitment has fallen short of their promise, probably not fully implemented. So this is like, as we are advocate, activists on public health or on primary health care, we need to move, or we need to advocate to ensure that, how to say, how to move this thing faster. So that's why this letter will mobilize, or will, how to say, inform the government, each government to reconsider or to re-promise or to redo, you know, or with the bold effort. Sorry. And then, so yes. And then one thing that I just would like to highlight as well is, as you know, how to say, the reason pandemic of COVID-19. So everything, especially health, public health or health system, you know, getting, or how to say, stepping back. So that's why we need to, at least we need to move a bit faster. So as a result, additional negotiations have been launched to strengthen pandemic preparedness and response, including call for a pandemic treaty, reform to the international health regulations, and a new fund to help prevent future health emergency. However, without a strong foundation of primary health care to address growing gaps in essential health services, the most vulnerable community will remain most susceptible to any threat, whether local and global, in scale to their health and well-being. So another thing is around, it is time for a radical research. As I mentioned, it's a time to ensure that those global leaders or head of state, you know, need to reconfirm, need to repromise, not repromise, to complete or to fulfill what they have promised so far. So 2023 we'll see two UN high-level meetings. As I mentioned, one is around UAC and another one is around pandemic prevention, preparedness, and response. So let's see what the letter, I mean the call to action that has been made in the letter. So one, we really focus on governance and equity in health. So by, you know, we prioritize people who has been failed by the system, not those who already benefit from those system. So three, how to say, key action or key strategy need to be taken by those, you know, government or health system. So one is around, you know, changing who has the power to set policy agenda and allocate resources at all levels of the government, so that the wealthy, privileged, or most vocal few, local, international, and global, are no longer dictating the life of the many. Meaning, like, we need to remove, we need to change, to remove. Because right now, most of the decision maker, policy maker, are the government officials. But we need to ensure that at least our affected community, our CSO, are a part of the decision-making process. So this is like one that I need to call for action. The second is to require that patient advocate, frontline healthcare provider, who are predominantly women and community, be included as equal partner in the leadership and management of healthcare service delivery. As I mentioned, we need to see the critical role of community, the community. We need to see the critical role of, how to say, people who are suffered, who are affected, who are impacted by those issues or those diseases. For instance, like people with HIV/AIDS, people with tuberculosis, people with COVID, for instance, or COVID survivor. We need to ensure that they're gonna be, or they can play a role model to lead the solution, how to say, or to mobilize their community, to educate, you know, to provide feedback to health system or health service. So this is like, we need to call to ensure that those, you know, in it. And then number three, insist on international agreement and responses, including for matter of global health security that foster genuine solidarity, equity, and mutual learning across country, and no longer permit of more powerful donor, leader, entity, and nation to put their priority above the rest. So this around, how to say, prioritize people, meaning like we need to put people in a center of response, or in the center of investment, in the center of reform, for instance. And strategy number two, we really looking at quality and service delivery, but meaning like what the service delivery look like, especially to meet the needs of affected community. And then this means like giving the people what they want, in terms of quality health services in their community that work and around their needs, preference, and everyday life. So this is in line to universal health coverage. And then linked to primary health care. Because right now, talking about primary health care, we understand that most of Ministry of Health official or health service provider, for instance, or health management official, they think that primary health care or service delivery belong to their side. But they never, or they don't think like demand side is in the need. So we need to think both sides, meaning like demand side and also supply side. So in this particular thing, we need to ensure that, the needs or the issue or the preference of those, client or patient, are well addressed. So we have a number of, key action points. So number one is earn people trust by consistently delivering primary healthcare services that meets everyone's needs across the lifespan. Number two, invest in all well-resourced, protected, diverse, and skilled team-based health workforce at community, subnational, national level, so that healthcare worker can ensure patient satisfaction and meet all essential health needs in time of crisis and calm. As I mentioned, this one is really linked to 3A and 1Q. Maybe this is a principle of human rights-based approach. We need to think about the service, availability, service accessibility, service affordability, and also quality of services. So we need to think about human rights-based approach, patient center, but in our context we call people center. And then the last one is around gender-based responsive. So we need to think about this thing. And number three is to set measurable target and report disaggregated data, transparency on quality across all pillars of primary health care, including capacity building, performance, or impact. So this is like need to be taken, and also by the government.
Chanthorn, do you have 1 more minute, please?
Okay. 2 more slides, sorry. 2 more slides. And then number 4 is earn people, sorry, the next one. Okay, this one. A demand system that guarantee high quality care for all people and community, remove all financial and other barriers to health visits so that everyone, particularly the more marginalized group, prioritize human rights, gender equity, and social determinants of health through multi-sectoral action. As our lady, this morning called to action to ensure that multi-sectoral response, or multi-sectoral accountability framework are in place in primary healthcare. This is the last one. Sorry. And then number 3, we really focus on health financing and also resilience. So we have a number of key actions. One is drive more, better, and localized investment toward health system based on primary health care, allocating funds according to each community and country needs and priority. Instead of diverting resources from one crisis to the next, ensure that every program for pandemic prevention, preparedness, and response includes specific investment for improving primary health care and the foundation of resilient health system that can adapt to new threats and sustain comprehensive health services no matter what. And this is the last one. Establish, as you mentioned, we need to think about the policy or law aspect as well. Establish policy and system of mutual accountability to uphold people's fundamental right to health, sustain private healthcare investment, and keep improving population health and well-being even as an administration come and go. And the last one is earmark financing to strengthen health data. We understand our health information system is very important, surveillance, information system, and community engagement in primary health care, and use comprehensive assessment to drive better decision making. So the data is very important. Can use strategic information, to inform the program or decision making process. And this is the last one, and also we need to call for your support and also engagement as well. to make this time different. So we urge leader and member states to prioritize primary health care in this negotiation as a 3-for-1 investment, universal health coverage, global health security, and also better health and well-being. You know, for one investment, meaning one investment covering three this pillar, and in universal health coverage, health security, and better health and well-being for all. Thank you.
Thank you, Mr. Chanthorn. It is interesting about Cambodia experience as well. So next one, we can see the Thai primary healthcare system in Thailand. Dr. Yupadee Sirisinsuk. Since two of them are Thai and I also Thai, so I can moderate in Thai, please. They say, okay. Ajahn Yupadee, can you please go to the podium, please? Okay. You can sit here also.
Sawadee. Good afternoon for the international participant. I have to apologize that I will talk in Thai. So you might need some translator machine from now. Okay, because I have พอดีมีเวลาแค่10 นาทีนะคะที่จะต้องสื่อสารกัน
minutes for the presentation. So the question is where we are in terms of primary health care services and fundamental health care in Thailand. So I'll be speaking on this topic in 10 minutes to give you an answer where we are at the moment. But whether we have been successful, the answer is up to the Thai people who will judge on the success of the Thai primary healthcare services. Today I will be sharing about the success factors that influencing the country's primary healthcare services and universal health coverage in order to share with our international participants joining this conference. We believe that to achieve success, we need several success factors, and Thailand can be a case study for lesson learned in terms of success factors, even though we are still a developing country. First of all, Thailand has a strong health infrastructure. As you can see, we have strong health infrastructure starting from the 1980s. Back then I was still a student myself. During that time, over 40 years ago, we had developed the foundation for today's success by establishing the district hospitals in the 1980s, and health centers in the 1990s, covering the whole country. This strong health infrastructure is not only those units close to the people or the community, but we also have this transfer mechanism to transfer patients from the sub-district to district to provincial level and to specialized hospitals. or university hospitals. Ideally, there will have to be this kind of transfer from bottom to the top, and all healthcare personnel will be assigned to all the clients, the patients, or every single person will be assigned their primary healthcare unit, and they can also be referred up the chain to the specialized care if needed. And in addition to the main infrastructure, we also have the health personnel, because a successful system cannot consist only of the buildings or equipment, but also healthcare personnel with good distribution across the country. So we have contracted health personnel project, including physicians, nurses, dentists, who are distributed across the country from the bottom to the top levels. So these health personnel also contribute to the success of the Thai healthcare system. Secondly, we also have the concept of to result in the universal healthcare coverage. This so-called triangle to move the mountain. This triangle consists of knowledge, social movement, and policy connections. So back in those times, we had the social movement among the patients that advocated for more knowledge building and leading to the policy decisions, especially by the Thaksin administration, which enacted the National Health Security Act, requiring all Thai citizens all living in Thailand to be able to access the essential healthcare services. In this National Health Security Act, there are certain terms which are clearly defined, including the comprehensive benefit packages. These packages cover all the expenses for patients, whether they are suffering from mild or serious diseases. We will be seeing some, looking at some photos later. And another term that is clearly stated is the use of general tax as source of fund with the lowest co-payment. So it is the funding of this universal health coverage system comes from the taxpayers' money. And we also clearly include the concept of stakeholders' participation to define the benefit packages, as well as the local implementation. So many patients have played a role in reflecting the complaints from the users in order to help improve the healthcare system. And also the local governments also played a role to provide matching funds to the national government. And also the system is defined as a closed-end payment system. And thirdly, the model development of the primary healthcare system was developed through international and local funds. And what I would like to mention particularly is the Thai Health Promotion Foundation, which is funded by sin taxes from tobacco and alcohol consumption. This foundation has in turn funded many health-related projects. Another source of funding is the local governments, which also provided funding for new innovation in the healthcare system. And the last factor that I would like to mention, even though the COVID-19 pandemic was on one hand a crisis, but also the opportunity to test the healthcare system. And when the national healthcare system fails, there are other public-led, population-led initiatives to address those gaps, such as the home isolation, community isolation. These are the new models of primary health care which emerged during the COVID-19 crisis. This community isolation deployed temples, mosques, or schools to support patients infected by COVID-19. With volunteers from the community themselves to provide the health care. These are the foundation of the primary health care successes. Which help make evident the importance of community involvement in the primary care setting, which has emerged. In this overview diagram, you can see the involvement of the district hospitals, provincial hospital, as well as the primary care units and clusters, consisting of new innovative clinics and units. Many of you might have already made use of these primary care units, including the pharmacy drugstore or the private nurse clinic or a private medical clinic, as well as telemedicine, which became important during the COVID-19 pandemic. So I will conclude my presentation by saying that today's universal health coverage in Thailand has enabled quality access to quality of care for all people in Thailand. Unfortunately, I don't have time to go into details about those who are non-Thais, but they can now access the same healthcare system as Thai citizens. So I don't have an answer whether we have succeeded, but I hope that this mapping of where we are can reassure us that we are in the right direction and allow public participation and patient participation in further improving the healthcare system. Thank you very much. Thank you. Dr. Yupadee, she is at the moment the Deputy Director General of the Health Security Office, who has a role to play in allowing public participation in the development of healthcare system. Now I would like to invite Kun Tanapol Dokkaew, the President of the Friends of Kidney Disease Association of Thailand next. Thank you.
Good afternoon. My name is Tanapol Dokkaew. I have an opportunity today to share with you about the access to primary care services in Thailand. Actually, I have three topics. The first one is the role of patients in accessing primary care services in Thailand, and the second one is how Thai kidney patients can access health services during COVID-19. And the third topic is what does the patient network do in disease prevention. So let's look at the first one. The role of patients in accessing primary care services in Thailand. In fact, normally patients do participate in the service units. What I mean by that is that they are working to complement each other. First, we work on the disease promotion among the patients. And what do we have to do secondly, and I think it's very important for the patient network, is that first we have to educate about the benefits of the universal health coverage in Thailand. Our system may differ from overseas. They may have one fund, one standards, but Thailand we have three funds. The first one is universal health coverage, or UHC, or Thai people call it gold card. And the second one is the Social Security and the system, and the third one is Comptroller Office 1. And so we have to provide the information on the benefits for Thai people so that they can access their rights universally. And thirdly, what we need to have is health literacy. This is a very important issue. We have to know about NCD, and NCD composes of many different diseases. We have to give this information to the patients and to the general public. And fourth, when we learn about the disease prevention, about their rights and health literacy, then they have to learn about how to write project proposals to seek for funding so that they can work on the project in the community for the people in the community, and so that they can it would start from the primary health service, right? And so this is the role of patients, which the patient network had been doing and participating in accessing primary care services in Thailand. The second part is the part which I think is very important for people with kidney disease to, how do they access health services during COVID-19. During COVID-19, I can say that Thailand and overseas, we're not different. we're quite in a lot of hassle because COVID-19 is a new disease, whether it's vaccine or medicine or accessing to service unit was problematic. And the most difficult thing was that kidney patients are specific patients who have to go to the service units. When they go to the service units, dialysis, people who need dialysis, they need it twice a week, and so the dialysis center in each hospital, in the primary care centers, they don't have it, firstly, and secondly, the community hospitals, some hospitals have this dialysis center, some not, and the provincial hospitals level, most of the provincial hospitals have this dialysis center, but not enough. And then we have university hospitals as well. As I said earlier, during COVID-19, kidney patients, most of the hospitals that I mentioned was almost full because people who were infected, they were hospitalized and we didn't know what to do. There's another group of patients who are infected, and when the hospital were full, they didn't know where to go, and that's the problem. And so we tried to come out and show our potential and play some important role as the patient network to allow patients to be able to access service. And so that's the starting point. The Friends of Kidney Disease Association and also the NSHO, we opened like a center, and you can see that this is the first point. We opened the center when patients called to the hotline 1330. They would have to find a bed. If they can't find a bed, they would have to contact the Friends of Kidney Disease Association, and we are like the center contact point to help find beds and refer to patients, and so they can access the services. And when the hospital were full and we are not able to refer the patients to the hospitals anymore, so we just worked with the private companies to open specific service center to help kidney patients to get the treatment during the crisis. We opened the center with the private companies so that our patient friends can access the service. So this is in the Greater Bangkok and Bangkok area, which was heavily infected area, and we could solve the problem. And in other provinces, we were able to get into the provincial hospitals and work with the hospitals there. And what we did during COVID-19 is that the patient network have our own van to transport patients. First, we asked the vans from foundations, four vans to be exact, and we got them from Team Rao Tong Rod organization, and partly some of them are taxis, and we also have partition between driver and also the passenger. Some taxis are from the patients itself, and the third part where we had to help the health ministry is to deliver medicine. And our association and patient network, we do deliver the medicine ourselves. We have our team sitting at the back of the room who did deliver medicine to the patients. Why did we have to deliver medicine ourselves? Because during that time, the vehicles that had to transport the medicine refused to do so. So we had to hire private vehicles or motorcycles to deliver these medical medicines. And so this is what we did to try to tackle the problems during the crisis. And so this is one of the roles that the patients played during the crisis. And lastly, what did the patient network do in preventing diseases? And the first one is that we strengthen and the organization and also create knowledge about health. We did conduct training to develop capacity and create leaders, and we did provide NCD related knowledge, and NCD is the non-chronic non-communicable disease, and this is actually the main problem that leads to other diseases. We do also provided knowledge about the rights to treatment so that people can access the treatment. And the second thing is that we push forward for benefits that we should be getting, and also access and rights to service. And you can see the pictures here. That's me. I was trying to help the kidney patients who have HIV who are not able to access this service so that they can get the rights to treatment. And the second part is that they can have the service center that can actually provide them service. And the third picture is me talking to the minister who was signing the document. This is very important because I push forward for free dialysis across the country. So these are the 3 important milestones. Thank you so much. And before we worked on the treatment benefits that the people should get, we had to make sure our data are clear. It's not like we go there and demand. We had to work on the technical issues and also try to develop and then push forward in the policy level. When we have the academic support, we can then propose to the government, and the government will buy our proposal because we have the academic work to support our work. When we advocate to this level, me as a patient and also a Thai person, what do I want to see? What do I expect to see? What I want to see is, and what I want it to really happen is, I want the health system in Thailand to be under one fund, and that the health treatment is of the same standard, so that we can reduce the discrepancy and inequality in the Thai health system. And lastly, I got a chance to be on the stage. I have 1 minute left. I will not forget to thank the person who allowed me to be on the stage. Thank you, Ajahn Orajitt Bumrungskulswat. And I would like to thank the Heart to Heart Foundation. Thank you so much. So it was not prepared. So thank you so much, Kun Tanapol. I'm very impressed with Kun Tanapol because I saw him from like 10 years ago when he was a kidney patient, and I didn't know how to help him because during that time, kidney patients didn't have any health security and they have to pay for themselves, and we have been fighting. And so congratulations, you have succeeded, and you already grown quite a lot, and I think your weight was higher as well. So we have some more we have 10 minutes for Q&A. Does anyone have any questions? We have a translator. You can speak in Thai right away. So there would be people giving you a microphone.
You can ask Kun Chanthorn from Cambodia as well, if you like. Any questions or comments? or if you want his telephone number. No one? Or is, you know, or already all information you need? All the three speakers have spoken on different angles, which also can link together quite well on primary health care, as well as innovations, including performance initiatives, as well as the advocacy to establish the healthcare, primary healthcare system. I'm from the Cancer Patient Network, and we have representatives from the Breast Cancer Society, as well as the Leukemia Society and digestive system cancer. We get inspiration from the kidney patient that they have fought their way into success, and I wonder if we, all of our cancer society, can join hands so that we can build a larger impact. So do you have any suggestions for us to help us to unite and become one large body which is more impactful? But of course, like the different cancer patients have different journey, whether they are leukemia patients or breast cancer patients, so as though they are all different diseases. Khun Tanapol, can you share with them? I actually, kidney diseases are also diverse. There are kidney transplant patients, dialysis, or diabetes-related kidney diseases. So how can we unite all of these patients? As the president of the association, I can tell you that it took us from 2006 until the present, over these 16 years, I actually had to, I visited kidney patients at almost all hospitals in Thailand. We shared with them all the problems faced by kidney patients across the country. So cancer, I believe, is not different. You have to find alliance to build network. You are a new generation, and you have developed Google Form to connect with new friends, new other patients. I think you have done so much. You have come more than halfway, and I think just a little bit more than you can have that unity that you would like. And I believe in the potentials of cancer patients like Khun Saichon, who started from nothing, and now you have a foundation. And the same with us. We started from a society, and now cancer, there is a cancer foundation, while the kidney patients are still at the society level, like lose body. So I give you the moral support. So yes, so if you have any time, please share with them your experience. Khun Bill as well, please feel free to come to discuss with Khun Tanapol. Any questions for Khun Chanthorn? Khun Sombat, please go ahead. I would like to ask Ajahn Yupadee about the ability of the pharmacies to provide equipment for the colorectal cancer patients, as well as the reimbursement. The question is that where is that request? It is still up to us at the National Health Security Office to propose that into the meeting. So I think colostomy bag, the colostomy nurses may not agree with this request. If these colostomy bags are to be distributed by the pharmacies, we are happy with that request. But when the experts said that who gonna provide care for you if you get your colostomy bags from the pharmacy, so there are still challenges in this issue. So I hope that the network will work with the experts to identify to build consensus on what would be best for colostomy patients, because the pharmacies are ready to provide them and have no problem at all. So that is the short answer. And also I would like to communicate to Kun Bell from the cancer patient network. Maybe there's still more that you can do in terms of the voice of the cancer patients. And Kun Tanapol has been worked very hard for the kidney patient association, but they still need new blood to support Kun Tanapol, who is working like going to all places in Thailand. So the same with the cancer patient network, you need also to build your own network, a new generation of people to support you, to strengthen the cancer patient network so that it covers all hospitals in all parts of the country, so that they will strengthen our voice. So, if you face any problem, these voices will have to be heard at the Ministry of Public Health or the National Health Security Office. So you need to raise your voices across the country in order to fulfill your dream. Kun Sombat has already the necessary experience. You just need to strengthen that, as well as to collect more data. It is probably not so hard now, and because the National Health Security Office, NHSO, is open to receive your ideas and feedbacks. Thank you. I have been thinking about the kidney patients in comparison to the cancer patients. Cancer can be cured, but for kidney diseases, as far as I know, the terminal kidney patients are different, because terminal cancer can still be cured, like in my own case. But for terminal kidney diseases, why do we say that it's incurable? And if we can make terminal kidney disease curable without dialysis, is it possible? Can it be cured? Short answer, to your question, which is whether, because kidney is an organ and it degenerates year by year until the kidney functions disappears. So for us to survive, we need to have some kind of replacement. The first way is the dialysis. Two is the open laparotomy dialysis, and then kidney transplant. All these three methods can prolong your life, but the best way, of course, is the kidney transplant, which allows you to live a normal life. But the best way, of course, is to prevent ourselves from becoming a kidney patient. Thank you. Because we have already run out of time, so I'll give you 1 minute each to leave something for the audience as a takeaway message or a challenge or an inspiration. From Kun Chanthorn, please. ขอบคุณครับ เนื่องจากหน้าที่ของผมนะครับก็จะเป็นเรื่องของระดับนโยบาย
Maybe just a quick response to lady, to build a strong network, because I have, work to strengthen the network of people with HIV/AIDS, the network of people use drug, transgender people, sex workers in Cambodia, and recently we just established the network of people living with and experience TB, and then maybe you can five points that you need to consider, and also that would be for the newly or how to say to strengthen your movement. So one thing is around the structure, maybe structure starting from the small and then to become bigger and bigger. So starting from the small and collect all your member community, and then try to create this group as many as possible, and then we can come up at district, provincial or national level. This is the first one. Second one is about to promote yourself, meaning like to sell who you are. So you need to get engaged. You need to communicate, as Dr. mentioned. So it very very important to show that it's like around selling your point, selling your product. So this is very important. Number two is about engagement and communication, and number three is around capacity development or building. So meaning both individual and also institutional. So individual meaning like if you have a leader to ensure that they have to be well capacitated, and the institutional looking at the procedure guideline or something to use as an internal regulation or system. And number four, and very important, is about partnership. Collaboration and partnership is very, very important. Either at your community network or CSO or private sector or government. So just to work out to strengthen that. And the last one, and very important, is about advocacy. If you you don't raise or you don't show the issue that you are facing, it's very hard to support. And my last message, because right now in Cambodia we are going to implement the booster implementation of primary health care. So we just met with Secretary of State who are in charge for primary health care. Cambodia right now we are going to implement 5 initiatives, or 5E. It's like a very good strategy. 5E's meaning like one is early education, because primary health care is really related to health promotion or education. Number 2 is early detection. So if you feel or you suspect of having any disease, please. And number 3 is early screening. Screening is also very important to assess to know your status. And number 4 is early diagnosis. And the last one is early treatment. So these are the 5E that are going to implement in Cambodia to boost the primary health care service or activity. Thank you.
Thank you งั้นเดี๋ยวท่านต่อไปเลยอาจารย์ยุพดีเลยค่ะ
ก็ค่ะขอบคุณค่ะก็คงต้องมีคำตอบเนาะ
So I think we have an answer where we are at the moment, but for all people in Thailand, we can be confident that we are following the right direction with primary healthcare access to everyone in Thailand, especially vulnerable groups, as well as patients of kidney diseases and cancers. But of course, the road is not paved by rose petals. There are still some rough spots, and I hope that everyone who is the owner of this healthcare system will voice your feedback so that we will further develop and improve our healthcare system. Kun Tanapol, please. So in 1 minute, in this 1 minute, I will try to use it as effective as possible. Thailand has 3 healthcare scheme at the moment, and what we are trying do is to unite all these 3 schemes into one, so to ensure consistency, equality in the healthcare system. Thank you. So I hope that you have gained plenty of knowledge and perspective on the innovative primary healthcare system. I would like to thank Kun Chanthorn Phorng, Kun Yupadee Sirisinsuk, and Kun Tanapol Dokkaew for sharing with us their perspectives. And this is the end of this session. So let's take a photo together, and for Thai participants, we will have a workshop at Magnolia 2 room on women health. So you're welcome to join us there.